Well, as I was saying, we all know the importance of a good night's sleep. Without one, it is almost impossible to function properly the next day. And more than 1.2 million Australians currently suffer from sleeping disorders. In fact, it's estimated that this is responsible for almost 10% of work-related injuries and nearly 8% of motor vehicle accidents. This week is Sleep Awareness Week, the perfect time to have a look at your own sleeping habits. I mean, do you suffer from nasal congestion at night? Is your snoring an issue at home? I tell you what, that can put a strain on relationships too. Well, maybe we have a solution for you. The O2Vent is a revolutionary mouthguard, apparently, that helps with these issues. And we're going to talk to Dr Chris Hart, the clinical director and founder of Oventus, the company behind the O2Vent. Thanks for your time, Chris.
Thanks for having me, Warren.
Yeah, well, just explain this. So this helps with breathing, does it? Or
Yeah, so basically it's a mouth guard, and I actually invented it for myself. I was a severe snorer and sleep apneic, but because I had nasal congestion, I found it very difficult to tolerate CPAP, and also oral appliances in my mouth made it difficult to breathe through my mouth because with the nasal congestion, I was actually an obligate mouth breather when I slept. And, the obligate mouth breathing leads to a lot of upper airway instability. And a lot of those patients snore, and many of them are also sleep apneic. So when I first developed it, I just needed to get some air through the back of my throat. So I'm a dentist professionally, and I actually just got some saliva ejector tubes and bent them around the outside of my teeth to get the air through to the back of my throat. And that was the invention of the O2Vent. We've obviously come a long way since then. Now we're manufacturing them, 3D printing them in titanium, and we've got design software and all sorts of things. But the genesis of it was my own problem.
Yeah, well, it's often how great ideas come about, isn't it? People, finding a problem for their own issue and then working out, well, this could be helping other people too.
Yeah, that's right. And, I think that we've just finished a clinical trial on the device earlier this year, and we actually showed that 100% of the patients wearing the device had a significant improvement in their snoring, and 82% of them had eliminated snoring completely. So, as far as the snoring goes, it was a phenomenal result. And at the same time, because a lot of snorers also suffer from sleep apnea, we showed some significant improvements in the sleep apnea as well, even in severe patients.
Yeah, it must be quite a process of coming up with an idea for your own purpose in your case, but then going from that to actually it being a product on the shelf, so to speak.
Yeah, look, it's been a phenomenal journey in reality. As I said, I was just trying to solve a problem for me, but then as a dentist, I noticed that at least half of my adult patients were also obligate mouth breathers, and a lot of them also were snorers and had sleep apnea. So we started then, I was just working within my own clinics and delivering them to patients, and we got a little bit of data on that, which looked quite favourable. So at the time, and this was about 2012, I was about to spend some more money on more patents to protect the idea, and wasn't sure whether I should. Fortunately, the patent attorneys introduced me to the current CEO, Neil Anderson, and he then took the idea to the CSIRO. And so we had a very rapid process of taking what was an ungainly plastic mouthguard initially to the CSIRO, and we developed software to design that bespoke for patients, and we started 3D printing it in titanium, and that allowed us to increase the size of that airway that I'd put in the device to 50 square millimetres, which is the same size as the healthy nose, and that was a real breakthrough for us.
So you needed a different material to a normal mouthguard to accommodate that.
Absolutely. So the titanium was great because it's phenomenally strong in thin sections, and the walls of the device are only 300 microns. So that means that all of the available area within the mouth where the tongue doesn't sit, we can use to direct air to the back of the throat. So it's basically, you can imagine a hollow mouth guard with an enclosed airway and a duckbill out the front. So as well as stabilising the jaw position and the tongue, as a lot of oral appliances do, we managed to get a second nose built within the mouth guard, and the air goes in the front, around the tongue, below the nose and soft palate, and straight into the back of the throat unimpeded. So it's that ease of breathing that made it so successful, particularly with people like myself suffering from nasal congestion or obstruction.
Does it take getting used to?
It's about the same size as a sports mouth guard. So most people, I think the average acclimatisation period on the trial was 4.5 days. It can take other people a few weeks, but everyone seems to accommodate it really well within a 2 to 3 week period.
Okay, thanks so much for your time. Good luck with it.
My pleasure. Thanks, Warren.
More information on that at oventus.com.au. But a great innovation by the sounds of it. And also good to see the CSIRO doing what they do well, and that's helping out with Aussie innovation as well.